Welcome. Hello again. I'm Harry Greenberger. I'm the president of the New Orleans Secular Humanist Association and the host for this show. We have a very interesting topic tonight. We're going to be talking about the new Mind-Body Center of Louisiana, and to talk to us about it are a couple of the folks with that group. I want to introduce you to Mindy Milam. And Mindy, after your name it says LCSW. Tell us what that is.
Licensed Clinical Social Worker.
Okay, and then we have Dr. Jose Calderon, who is obviously a doctor, and you're the medical director for the group, right?
Yes.
Now, what's happening very soon is that there will be the official opening of the Mind-Body Center, which is a nonprofit educational organization dedicated to teaching, training, research, and promotion of mind-body modalities throughout Louisiana. That's going to take place on Friday, October the 16th, from 7 to 9 p.m. at Tulane School of Medicine. And at that celebration, their guest speaker will be James Gordon, MD, founder and director of the Center for Mind-Body Medicine in Washington, D.C., a renowned expert in using mind-body medicine to heal depression, anxiety, and psychological trauma. Now, for those of you secular humanists who might ask, what does this mind-body medicine have to do with us? Let me put it this way. We do not reject the connection between our minds and our bodies and what our minds can do in relation to healing illnesses or changing our mood. The difference between our approach and that of those people who may pray for the same results or have other sorts of religious experiences which in effect appear to be mind-body connected. We understand the science of it. And since I read all the literature that came from these people, I didn't see any reference in there to religion or prayers, so I'm assuming that we are on the same page of the same book. So my first question is, what is mind-body medicine?
Well, mind-body medicine is a discipline within scientific medicine that has developed and has becoming part of mainstream medicine in the last 50, 60 years that understands people's connection, their mind, their body, their relationship to their communities, their environment, and how all of these factors, and their spirituality for that matter, whether it's religious or secular to that, and how all of these influence health, and how one can influence health by doing interventions at many different levels too as well.
Now, why is that described as medicine?
Because it's in this case it's used for to treat conditions, to alleviate conditions, to improve the quality of life of people that suffer from conditions, medical or psychological, and because it has a scientific background to it.
All right. Well, I'm reading from your own literature that says what is mind-body medicine.
Yes.
And it says mind-body medicine is a two-way street. It focuses on how thoughts and emotions impact our physical health and how physical health influences thoughts, emotions, and our sense of who we are. Mm-hmm. Could you expand on that concept for us?
And I think I want to add one thing to what Jose just said, which is that I think medicine encompasses wellness. That medicine is not just, and I'm not an MD, but I certainly work with mental health, that medicine impacts wellness and prevention, and instead of just focusing on disease. So I think that's one of the things that I'm so drawn to this whole body of work for, because people have incredible potential to lead wonderful lives, and that's what we want to do, to empower people to understand the relationship between their minds and their bodies and their emotions, and give people tools so that they can make informed decisions and the best decisions so they don't end up suffering with health conditions or suffering from mental health conditions.
Well, you mentioned something that I I hear there's a lot of talk these days because they're trying to come up with some sort of new health program for all the people who don't have insurance and whatever. And I hear very often some talk about there should be more emphasis on wellness rather than on cures. Mm-hmm. And that if, in fact, some of the money that's being spent on treatment were being spent on prevention of illness, it could come out actually to be cheaper. Mm-hmm. Is your program, will your program in any way qualify for coverage under hospital or medical policies or Medicare or any? Does it qualify under any program?
Some of the groups that we do, absolutely, they do, and people get reimbursement for them.
So it is at least there is some recognition that prevention is a form of health care.
Yes.
All right. Well, I'm going to continue with your own brochure.
Yes.
That says Mind-Body Medicine is an empowering approach to wellness based on self-care and self-awareness. Mind-body skills are easy to learn and apply. It's based on self-care and self-awareness. Okay, what care and what awareness?
Part of the fundamental aspects of mind-body medicine is to bring awareness through different techniques to what's going on in people's minds, the quality of their thoughts, the quality of their attention, what's going on in their bodies, to as well what's going on with their emotions that they're having. And then one has the ability to then, instead of having a knee-jerk reaction to things to events that are unfolding on a moment-to-moment basis, then one may have an opportunity to have a response and have a choice. But it takes to learn, it takes to observe, to notice things as they unfold, and then to make a decision to enter life in a creative and a courageous way.
And one thing that I would add as well is, as a therapist, I, of course, listen to people struggling with all kinds of life situations and problems. And the number of people who struggle, say, with the issue of using food as comfort, who don't really recognize when they're reaching for ice cream or candy or cakes or whatever, that they're trying to fill something else besides a physical hunger. And you can't address those kinds of patterns without having self-awareness. So, so often we're either focused on the past, what we did wrong, our failures, our regrets. This is for people who are suffering. Or we're focused in anxiety about the future. What's going to happen to me? Can I manage? Will I be okay? And so part of what we're teaching with self-awareness is teaching people how to know in the moment, what's going on with me right now? When I first sat down here and I feel my heart beating because I'm anxious, I can be aware my body's having a reaction. And now I know the tools that I can use to address that instead of just ignoring it and plodding forward. There are just so many examples of ways that we are taught really to disregard our pain.
Yes.
I think especially for boys as young children, being taught, don't cry, don't feel that. We learn all kinds of ways in this culture to numb ourselves to our life experiences, and people don't have the skills or tools to know, how do I manage whatever I'm facing in my life?
I'm assuming that you talked to your heart and said, it's okay, don't beat so hard.
That's exactly.
But you also said something that I think is connected with what you were talking about, which would be breaking bad habits or maybe obsessions. Is that something you all that you address? Because everything I read about people who want to lose weight, and they say it's not a diet you need, it's a change of lifestyle. Mm-hmm. Is that in keeping with what you all are doing?
Yes, and let me just add on to what Mindy said. For example, I work with a lot of people that struggle with addictions and habits, and they struggle with compulsions. And so I tell, for example, to bring this example of awareness, I tell somebody that wanted to stop smoking, if you want to stop smoking, the best thing where to start is to smoke mindfully. And he says, what do you mean smoke mindfully? I said, well, bring full